Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today that I like to share with my viewers is meeting the challenges of acute and chronic pain among our senior citizens. And this is a very interesting articles that I have read through the couple of journals, and then I summarized everything. Previously, I have talked about senior health safety, their brain and balance, and all those my articles are linked to my website. So today, I'm going to talk about the acute and chronic pain among our elderly. So what happens as we are gradually getting older, our tolerance to pain decreases. Pain becomes a part of our life, increasing in intensity. According to statistics, 26% of the adult aged 45 to 64, 31% of the individual, they develop chronic pain, such as persistent aches, stiff joint disability due to immobility of the joint. Second slide, please. So what are the causes of this pain? The causes of the pain I have classified into acute and chronic. The causes of acute pain, most important thing is trauma, motor vehicle accident, fall. The main pain concerns include musculoskeletal disease, neurodegenerative conditions, chronic osteoarthritis that involves the major joints in the body, diabetic neuropathy, and malignancy. So the acute pain signals are generally transmitted through the body through sodium channels, which play a significant role in pain signal transfer to the body. Next slide, please. So what are the facts? Affects 80 million people in United States each year, and it is defined as the pain that lasts for more than 3 months. Sudden onset of pain, like I mentioned before, caused by trauma, fall, motor vehicle accident, post-surgery, and malignancy. Next slide, please. So here is a diagram. I am showing it to you about the neck pain. Although current therapies are effective for reducing the acute pain in different clinical situations, further limitations are developed due to side effects, contraindications of the drugs used, and also the abuse potential. Next slide, please. So new researches have been done, and I have gone through a lot of researches about what is the brain connection with the pain, and it's all, I have mentioned it in the bibliography. So what is the new research? The new research shows that chronic lingering of pain may lead to fast aging of the brain cells. There is accelerated brain aging and cognitive function decline in chronic musculoskeletal pain, in particular, such as knee osteoarthritis. The neuromarkers for early detection and interventions are used during the diagnosis and treatment of the pain. Next. So what are the acute pain signals? The pain signals are transmitted. The tender point, there are specific tender points in the body that causes pain when pressed. The pain, whatever happens, is when you touch these tender points, it is pressed and it starts into the larger area. And so these tender points and the pain radiation include radiation down to the legs, arm, or the back. There are 9 pairs of tender points, and each pair has 1 point on each side of the body. These tender points, what are these tender points? These tender points include upper part of the chest, back of the head, outer elbow, knee, hips, and top of the shoulder. The most painful pressure points are located between the chest and the navel area, because this area, it hits the solar plexus, which is very painful, and it might also affect the breathing. So in other words, I'm showing you the diagram about all the tender points, starting from the head, neck, chest, lower down, elbow, knees, and the foot. So these are the areas. Just to mention that in the chest area, there is a more nerve dendrites, nerve cells, so that causes an excruciating pain, including the shortness of breath due to involvement of the nerve fibers that goes to supply the lungs. Next slide, please. So what are the painful muscle conditions? The painful muscle conditions that we should be aware of are kidney stone, childbirth, trauma, shingles, trigeminal neuralgia, post-surgery, back injuries, and not to mention of major joint arthritis like gout and more. So what are the 5 P's of pain? Even back in medical school, we used to learn and remember the 5 P's of pain: pain, pulseless, paresthesia, paralysis, and pallor. So what happens? What are the symptoms of chronic pain that is detected with the pressure point? Chronic headaches, chronic neck pain, unspecified joint pain, hand, back pain, chronic hip pain, neuropathy, and foot pain. So what is pain? Pain is a subjective issue. Along with the actual tissue damage, biologic, psychological, and social factor, they all combine together and create a chronic pain. These biological factors also include like sex, race, ethnicity, genetic diseases, nervous system sensitivity, inflammation, stress, economic factor, and more. So how do you measure the scale of the pain? I have put this slide to see the first 3 are mild, 1, 2, 3 mild, then moderate and severe, and we ask our patients what is the scale of pain. Is it mild, moderate, or severe? Because accordingly, the treatment depends upon the management of pain. So what are the guidelines to the painkillers? This has been written so many times regarding the painkillers. So the following are the pain medication for a layperson. I'm talking about a layperson, means I'm talking about the simple things that you can do if your pain is within mild to moderate. And they are like acetaminophen, oral steroids, antidepressant, non-steroid inflammatory, muscle relaxant, and opioid. Furthermore, physical therapy, rehabilitation, psychotherapy, and medications are all recommended for the pain management. So the non-pharmacologic modalities, the simple ones that we can manage at home with the pain, include ice and heat, massage and cognitive behavior therapy to help educate how to cope with, and the preventative skills are good strategies. Following are the barriers to effective pain management in elderly people. Patient, family perception, knowledge, belief, and also the attitude of treating physician. The other challenging factors include, with the advancing age, drug resistance, kidney and liver diseases, dementia, advanced chronic kidney diseases, Parkinsonism, severe disability, osteoarthritis, and gout. So these are the meeting the challenges of elderly regarding pain management, because they already have an underlying disease. And uncontrolled chronic pain can affect the endocrine system, hence there is abnormal high or low level of testosterone, catecholamines, glucocorticoid, and testosterone, and all this can aggravate the pain. So what do you do? Major challenges while caring the elderly include problems. The major challenges include their problem with their mobility, navigating their health care, the mental issue, financing, and preparing for the end of life. So major health challenges that the underlying diseases that causes more aggravates the symptoms of the pain include diabetes, osteoporosis, Alzheimer's disease. So the treatment plan includes a very careful physical and mental evaluation of the individual, a good psychological checkup, blood chemistry to rule out curable diseases like thyroid dysfunction, adrenal dysfunction, X-rays and CT and MRI. These are the further diagnostic evaluation to the problems. So in conclusion, there are many healthy problems facing our senior citizens as we get old. Tolerance to pain tends to decrease, as well as intensity, how it is felt. By carefully considering the treatment and medication laid out in the presentation, we can help our elderly enjoy the best lifestyle possible. That being said, remember always to consult your personal physician, a caretaker, and also the cognitive brain functions by the psychologist and the psychiatrist on all matters that are relating to the health concern. And like I mentioned before, each problems could be unique to each individual. So these are the bibliography that I have mentioned, that is mentioned here, from where I got the articles. I got the subject that I talked about, And here are a few things that I like to show, which is a brain and balance. Balance is a very important part of our daily life. Whether we are adults, senior citizen, we have to maintain the balance. So this is a picture that I can show about brain and balance. This will be included in my lecture or in my slide presentation later on. So the balance control process, the three major components for balance control are our sensory system for an accurate information about our body position, which is related to the environment. Brain function, eyes, our brain ability to process this information, and later on our muscles and the joints for coordinating the movement that maintain our balance. The loss of balance control occurs when there is any pathology from the diagram, as I have mentioned. Loss of balance occurs when there is any pathology in the brain, eyes, ear, vestibular system as we grow older. The natural aging process produces changes in our body and brain due to poor circulation. However, healthy senior citizens might not have any of issue. Dizziness among seniors can be due to degenerative infectious process in the brain. Diseases are not only the factor. There could be another factor involved, such as stroke, head injuries, and more. So there are certain protective measures that for the senior citizens that have been mentioned, and it is included in my website. The final thing is the health hints for over 60s. Taking care of our health at any age is very important. As we age, bodies become more susceptible. The diseases through living healthy lifestyle. We have to put up with what underlying diseases which we have. However, preventative measures include a regular, well-balanced diet, immunizations, proper immunizations according to the seasons, according to the age, physical examination by your physicians, a dental checkup for periodontal disease, vision checkup every 2 years, hearing as needed, breast examination and mammograms in female, blood sugar and glucose tolerance test to detect for diabetes or pre-diabetic at your doctor's recommendation. The warning signs of diabetes include increased thirst, frequent urination, craving. Prostate checkup is very important. The warning signs of prostate cancers include frequent urination, difficulty voiding, and blood. There is another section about cognitive brain therapy, mental depressions with them. And this is a whole new chapter about the cognitive studies, brain studies that is done by the regular physicians, your primary care physician, the psychologist, and accordingly they are grouped to mild, moderate, or severe form of depression. Depression is a very big issue these days. Also post-COVID depressions, and it is lingering. There are more and more mental depressions going on among, like I mentioned before. So the proper treatment includes regular checkup with your social service, the psychologist, and the psychiatrist. I did not go too much about details about the drugs because that is another entirely different chapter, like opioids, the chronic use of the narcotics, like codeine, and this is another part I did not go through in this present slide presentation, but they are all linked to my website, which is www.drniruprasad.com. And lastly, I thank all of you to listen to my presentation today. I'd like to thank our viewers for attending this session, which is very important for control of chronic pain in our elderly. Until I see you all, have a very, very safe summer and the fall seasons. Thank you very much.